Probably the most classic way to develop hip rotation is with the 90-90 position. So 90-90 takes its name from the angles, which means that you got to make sure that you have 90-degree angles. So 90-degree bend in the knee, both of them 90 degrees here, so it looks like a box with an open top. You're going to, for the front leg, you're going to twist your hips forward so that you're trying to get your belly parallel to this leg. And so this is the classic 90-90. You're going to lift up and fold forward over that leg. And so ideally, you're trying to lift and lengthen, like if you could put your belly button as close to your knee as possible, you would. That's going to give you that anterior pelvic tilt. You should be feeling the stretch in the back of the hip. So if you feel the stretch in the front of the hip, that is called closing angle hip pain, and we do not want you to have that. So if you have closing angle hip pain, you might need to go work with somebody basically to kind of figure out that angle specific issue that you're having. So try your best to get into a position that does not light that up if you have that. Also, if your knee is way off of the ground, or if you're feeling like this is really lit up here, you're going to need to regress this position. And so to regress the 90-90, you're going to lean out to the side some more. You also could sit yourself up on a little bit of couple yoga blocks or some, like a small 12-inch box, something, or 6-inch box. I mean, that would be better, 6 inches, just to sort of decrease this angle. Does that make sense? I hope that makes sense. Can't verify because we're on a video. So you would lean out to the side, and then the same thing is going to happen here. You're still going to stretch forward, but you're just going to cruise forward at this angle. So it's just like everything is tipped slightly. Okay, so back to the regular 90-90 position. So you're going to come forward here, and you're going to hold this passive stretch for 1 to 3 minutes. And again, like I've said before, this is a great position, but if you're just doing the passive stretching, you're doing yourself a disservice. You're not completing the picture. And this is why Kinstretch is so effective, because it has the isometric strength training and all of the other kind of motor component things that are missing from just a passive stretching routine. So we're going to do this passive stretch here, and then we're going to do these contractions. And so a PAILs contraction in this front leg 90-90 is pushing the front foot down into the ground. This foot goes down, you're going to squeeze your arms, squeeze your torso, full body effort, push as hard as you can after you've ramped up. Hold for 10 seconds, slowly relax. To do rails here, you're going to pull your belly and your thigh together. You can also add rotation by trying to put the foot up here. And so you're thinking about actively rotating the femur while also closing this front angle here and squeezing those tissues together, like you're trying to hold on to a piece of paper that somebody's trying to pull away from you, or a shoe, or whatever size of thing fits between your body and your leg. And relax. And then deeper stretch to see if you can hold this stretch for 1 to 3 minutes. If you are doing this just for the supersets, you're going to get into the stretch, hold for about 10 seconds, and then push down with this foot for 10 seconds. Do a couple of hip capsule cars, the hip rotation, and then pop on out. Now for the back leg, you're going to turn your belly towards the back leg. This is maxing out internal hip rotation on this back leg. Ideally, you're sitting up as high as you can, but for me, I get a little bit of discomfort in my hip when I'm up too far, so I have to sit back. So I'm still trying to keep my spine straight. I'm still trying to rotate my pelvis. And then I'm just going to hold out in this position for 1 to 3 minutes for my stretch. PAILs here is pushing this foot down, like you're trying to get the foot back underneath the knee. So you're going to ramp that up, full body effort, push that foot down, hold for 10 seconds. Ramp the contraction back down, and for rails, you're going to try to lift the foot up. And so there's a couple ways you can do this. You can either try to just purely rotate and lift the foot up. You can also try to rotate the whole body towards the leg and lift the foot up at the same time. That's a little more intense. Hold that for 10 seconds, relax, see if you can get a little deeper into the position. Hold for another 1 to 3 minutes. And again, if it's just the PAILs, you're just going to get here, get comfy, and then push down for 10 seconds, do some capsule cars, and then off you go.